Hello everyone, my name is Sean Malchua Baldivia and I am a nursing student from the Coast. And I am going to perform rectal installation. And first, the definition is rectal suppositories are used primarily for their local action such as laxatives and fecal softeners. Systemic effects are also achieved with rectal suppositories. It is important to ensure the suppository is placed past the internal anal sphincter and against the rectal mucosa. Assessment. Assess the rectal area for any alterations in integrity. Two is assess recent laboratory values, particularly with the patient's WBC and platelet counts. Patients who were thrombocytopenic and neurotropenic should not receive rectal suppositories. Assess relevant body systems for the particular medication being administered. Assess the patient for allergies. Verify very verify patient name, those route and time of administration. Assess the patient's knowledge of medication and procedure. Assess the patient's ability to cooperate with the procedure. Objectives to instill directly the medication suppository into the rectal area, to provide means for rectal evaluation to obtain desired therapeutic effect. Equipment, suppository, water-soluble lubricant, clean gloves, medication card.
Gather equipment, check medication, order against the original physician's order according to agency policy, clarify any inconsistencies, check the patient's chart for allergies. This comparison helps to identify errors that may have occurred when orders were transcribed. The physician's order is the legal record of medication orders for each agency. Step 2 is to know the actions, special nursing considerations, and safe dose ranges, purpose of administration, and adverse effects of the medication to be administered. Consider the appropriateness medication for the patient. This knowledge aids the nurse in evaluating therapeutic effect of the medication in relation to the patient's disorder and can be also used to educate the patient about the medication. Step 3 is to place medication on a tray or move the medication cart outside of the patient's room. Organization facilitates error-free administration and saves time. Number 4 is transport medications to the patient's bedside and keep the medications in sight at all times. Careful handling and close observation prevent accidental or deliberate disarrangement of medications. Step 5 is to identify the patient by checking the name and identification of the patient's identification band. Identifying the patient ensures the right patient receives the medication and helps prevent errors. Explain the procedure to the patient, perform hand washing and wear gloves. Assist the patient to his or her left side in seams position. Drape accordingly to only expose the buttocks. Allows for easy access to anal area. Left side decreases chance of expulsion of suppository. Proper draping maintains privacy. Remove the suppository from its wrapper. Apply lubricant to the round end. Lubricate and the index finger of your dominant hand. Lubricant reduces friction and administration increases patient's comfort. Step 10 is to separate the buttocks with your non-dominant hand and instruct the patient to breathe slowly and deeply through the mouth while the suppository is being inserted. Slow, deep breaths help to relax the anal sphincter and reduce discomfort. Using the index finger, insert the suppository round and first along the rectal wall. Insert about 3 to 4 and suppository must make contact the rectal mucosa for absorption to occur. Use toilet tissue to clean any stool or lubricant from round of the anus. Release the buttocks. Encourage the patient to remain his or her side for at least 5 minutes and retain the suppository for the appropriate amount of time for the specific medication. Prevents skin irritation, prevents accidental expulsion or suppository, and ensures absorption of medication. Perform hand hygiene, of course. Assist the patient to a comfortable position. Evaluate patient's response to the procedure and medication. Evaluation: patient cooperates with rectal or suppository installation. Desired that therapeutic effect is obtained. Experiences no adverse effects including allergy response. Systemic effects or injury.